Basic drug details. Generic name, Ceftibuten. Drug class, third-generation cephalosporin antibiotic, beta-lactam antibiotic. Dosage forms, oral capsules 400 milligrams, oral suspension 90 milligram 5 milliliter, powder for reconstitution. Brand name, Cedax. 2. Definition. Ceftibuten is a broad-spectrum oral cephalosporin antibiotic used to treat infections caused by susceptible bacteria. It is structurally related to other cephalosporins and is known for its effectiveness against gram-negative organisms and certain gram-positive cocci. Mechanism of action. Ceftibuten works by binding to penicillin-binding proteins, PBPs, within the bacterial cell wall. This inhibits the third and final stage of bacterial cell wall synthesis, peptidoglycan cross-linking. Cell wall disruption results in osmotic instability, leading to bacterial cell lysis and death. It is bactericidal, kills bacteria, rather than bacteriostatic, inhibits growth. Inclusion 4. Indications, uses. Ceftibuten is indicated for the treatment of mild to moderate infections caused by susceptible bacteria, including adults and children, acute bacterial exacerbations of chronic bronchitis, ACB, pharyngitis and tonsillitis caused by Streptococcus pyogenes, acute otitis media, middle ear infection, urinary tract infections, UTIs, e.g. caused by E. coli Proteus mirabilis, enteritis and gastroenteritis, e.g. caused by Salmonella, Shigella. 5. Contraindications. Ceftibuten should not be used in the following cases: known hypersensitivity or allergy to ceftibuten or any cephalosporin antibiotic, severe allergic reaction to penicillin antibiotics due to potential cross-reactivity, patients with history of Clostridioides difficile-associated diarrhea or severe colitis. 6. Precautions. Before taking this medicine, inform your healthcare provider if you have penicillin or cephalosporin allergy, kidney disease, adjustment of dose may be needed, gastrointestinal disease, especially colitis, pregnancy, use only if clearly needed, classified as pregnancy category B. Breastfeeding. It is not known if ceftibuten passes into breast milk in significant amounts. Use with caution. Phenylketonuria, PKU. Some oral suspensions may contain phenylalanine. Important note, overuse or misuse can result in antibiotic resistance. HAS 7. How to use. Follow the dosage and schedule exactly as prescribed. Capsule. Can be taken with or without food. Oral suspension. Must be taken on an empty stomach, 1 hour before or 2 hours after meals. Shake well before use. Use a proper measuring spoon syringe, not a kitchen spoon. Complete the entire course of treatment, even if symptoms improve. 8. Dosing information. Adults, 18 years, 400 milligrams orally once daily for 10 days, may vary with condition. Pediatrics, 6 months, 9 milligrams per kilogram day once daily for 10 days, maximum 400 milligrams per day. Indication, pediatric dosed. Acute bronchitis, 400 milligrams daily, 10 days, not typically used. Otitis media, 9 milligram per kilogram day, 10 days. Pharyngitis tonsillitis, 400 milligrams daily, 10 days. 9 milligrams per kilogram day, 10 days. Urinary tract infection, 400 milligrams daily, 7 to 10 D. 9 milligram kilogram per day, 7 to 10 days. NAS missed dose. Take as soon as you remember. If close to the next dose, skip the missed dose. Do not double the dose to catch up. Overdose symptoms: nausea, vomiting, seizures, rare, diarrhea. In case of overdose, seek emergency medical help or contact a poison control center. 10. When to stop or avoid taking. Stop the medication and contact your doctor if you experience allergic reactions, hives, swelling, rash, difficulty breathing, you have persistent diarrhea, especially if it contains blood or mucus, symptoms worsen or don't improve after several days, you develop signs of liver or kidney dysfunction. 11. Side effects. Common side effects: gastrointestinal, nausea, vomiting, abdominal pain, diarrhea; neurological, headache, dizziness; others, fatigue, taste disturbance. Less common serious side effects: allergic reactions, rash, urticaria, pruritus, anaphylaxis, Clostridioides difficile associated diarrhea, elevated liver enzymes, AST/ALT, superinfection, vaginal yeast infection, oral thrush, hematologic, eosinophilia, leukopenia, rare. 12. Vital information, warnings, and advice. Complete the entire prescribed course, even if symptoms resolve early. Not suitable for treating viral infections, e.g. cold or flu. Store oral suspension in the refrigerator. Discard after 14 days. Use caution in people with renal impairment. Dose adjustment may be necessary. Prolonged use may lead to resistant organisms or fungal infections. Report any unusual bleeding, fatigue, or signs of jaundice. Hack 13. Drug interactions. Other drugs that may affect ceftibuten. Drugs that may interfere with ceftibuten. Probenecid decreases renal clearance of ceftibuten, increases blood levels. Antacids, especially those containing magnesium or aluminum, may reduce absorption. Iron supplements may bind ceftibuten and reduce efficacy, space at least 2 hours apart. Live bacterial vaccines, e.g. oral typhoid vaccine, reduced effectiveness due to antibiotic activity. Nephrotoxic drugs, e.g. aminoglycosides, vancomycin, increased risk of renal toxicity. Always inform your doctor or pharmacist about all medications, supplements, and herbal products you're using. Summary. Ceftibuten is a well-tolerated and effective oral cephalosporin antibiotic used for various bacterial infections. It has a convenient once-daily dosing schedule, but must be used cautiously in individuals with allergies to beta-lactams or those with renal impairment. Adherence to proper dosing, timing, and completion of therapy is crucial to prevent resistance or complications. Thank you. Have a nice day.